Hi, good morning. I'm Dr. Ben Newman. I'm a molecular biologist. I've studied coronaviruses for over 20 years, and I'm here to try to answer your questions based on things that are published in the scientific literature. First question of the day is from Fiona. Good morning, Fiona. Okay, question is, so in the Northern Hemisphere, flu season will soon be upon us. Yeah, and that's a kind of a neat thing. So the flu in most people is going to be in and out. You'll have had it and be done with it and kind of immune within less than a week, probably around 4 days is all you would notice. And so for this virus to exist and for it to have a season, it always has to be infecting somebody. It can't just, go from flu season to dead for 6 months to flu season in the southern hemisphere to dead for 6 months like that. Doesn't work. So somewhere it's always flu season somewhere. Like it's always 5 o'clock somewhere. It's definitely always flu season somewhere. So yeah. So like when it started and when it stopped, these are kind of arbitrary points where we say, okay, there are enough cases here now that we can say, yeah, it started, but it's a real arbitrary distinction for a thing that is literally happening all the time somewhere. Yeah, okay, so two related questions. Let's get to the actual questions, shall we? Is influenza another example of a coronavirus? All right, yeah. So the answer is no, but from a certain perspective, I can see how it might look that way. For example, let's imagine you are living in the Ohio countryside, which is, I don't know, I was in a suburb, but whatever. It's near enough to where I grew up. And so there you will have the Amish. And I guess the good thing about this little example is that the Amish kind of renounce technology as part of their beliefs, and so probably none of them are watching. So as you're driving through Amish country in your vehicle, regular gas using vehicle, you'll see that they have a lot of horse and carts there that they use to transport themselves and transport things to and from the market and stuff like that. Yeah. And so, fine. And so, if you are a farmer in that part of the country, you could say, well, is there a difference between a brand new Ford pickup and a brand new horse and buggy? And if your perspective is, will this thing transport my tomatoes from my farm to the market? The answer is, yeah, they will both do that job. But if you take one step back and look at them even a little bit, you'd say, no, those are really not the same. They overlap the tiniest bit in that they can do the same job or a similar job, but the one does it faster and maybe with more pollution or of a different kind of pollution. So it's the same way with coronaviruses, influenza viruses. They're totally different viruses, yeah, as different as a horse and an internal combustion engine. But they both grow in your lungs, and so they can both make you feel as though you've got something in your lungs and nose that's giving you a bit of a fever. And basically, any virus that you get in that place is probably going to make you feel about the same. So yeah, there'll be some aspects of the disease, like especially the early kind of generic symptoms, that'll totally overlap. And literally everything else about them, from the way they're put together to the way they go about their business, totally different. Yeah. But yeah, it's a good question. It keeps coming up, and we seem to have decided that this virus is going to be exactly like the flu virus, even though, like I said, completely different things. And so with that comes this expectation that when flu season peaks, we're going to have coronavirus season that's going to be the same time. Could happen, but we don't know if it's going to happen because the coronavirus is really nothing like the flu virus. They just happen to cause some similar symptoms for a little while. Yeah. So there you go. That's the answer to that. But all right, so let's see. So why, if we're social distancing and wearing masks, hashtag team mask, I love it, I love that hashtag, will it be resurging and indeed anticipated to be very bad this winter? Like bad, it says, yeah, which is pretty bad. So yeah, that's the assumption. The assumption is that because flu virus has a peak every year, which is around, I think the actual peak is February, but it really gets going by December or something. And January is pretty miserable, so there's a little curve there. thing is, the few coronaviruses that we know about tend to peak either in the spring or tend to not really have a peak. Common cold coronaviruses, and there are four, again, totally distinct viruses, but they're all put together in the same way. Like you could have four different cars that all have internal combustion engines. You say no, a Nissan is not a Ford, yeah, but yeah, there's kind of a similarity there. So that's you got to be kind of that close to be a coronavirus, to be part of the coronavirus club. And so there are a couple reasons to think why it could be bad, but the reality is we don't know whether it's going to be bad, and our actions are going to determine whether or not it is bad. Almost certainly, yeah. um, yeah, basically, what we do will determine the outcome, just like always. Yeah. So, yeah, if it's like flu, then it'll peak in the winter, and fine. But there are viruses that peak in the summer, viruses that peak in the spring, viruses that peak in the winter, and there's not a good explanation for why one virus should peak at a certain time always. A few cases, yes, like Middle East respiratory syndrome is a coronavirus. Peaks in the spring when the baby camels are born. We think that is the driver, because bats give it to camels, the camels give it to baby camels. The baby camels then get real sick and sneeze onto people. Actually, don't get that sick. Yeah, they're camels. They're very stoic things, seemingly. And then people get it and pass it to each other. But yeah, the truth is, the virus can only spread if people have their mask off and are in the same vicinity as each other, or are in the same place pretty close in time to when the other person's been there. That would be like the outside, less likely way for the virus to actually transmit. And unless we do that, yeah, this virus is not going to grow. You're right to say, why is this going to happen? But with a change in behavior comes a change in risk and a change in the likelihood of virus spread. So we've got people that are going back to school now. We've got a lot of sports that are starting up, not just here, but around the world. So with changes in behavior, those can potentially drive coronavirus. Now, I know we've got listeners all over the world, but here in the U.S., we had Labor Day, I believe it was yesterday. And so I'm kind of, gripping the, the arms of the chair and waiting, because probably about 2 weeks from now, you will start to see a pretty good rise from Labor Day. And I'm basing this on the big rise that we saw on Memorial Day, which is another nice holiday where people like to go out and have a barbecue and have a good time and get together with friends and family and all these things. Yeah, if well, just bringing people together like that is risky, even with a mask. But a lot of people would feel like it's a good day to relax. It's a day off work and a day to just relax and not have to wear a mask. And stuff like that is probably going to drive up cases. But in different parts of the world, the answer is going to be different. And yeah, so that's why you're going to get peaks in different places at different times, essentially, I think. So here in Texas, where I am right now, virus numbers were dropping, but then we started going back to school at the end of August. And so remember, you go about 10 days to 2 weeks out, and that's where you will see the effect of whatever change in behavior has happened. And so now the numbers have leveled off, and I bet they're going to start going back up. And so the leveling off point was about September 1st, which is about 10 days after school started up. So, yeah, I don't know. Yeah. We still haven't seen the big rise yet. I'm hoping I'm wrong, but I don't know. Probably not wrong on this one. We'll see. That'll be a nice being wrong, I would say. So there you go. They're good questions. Yeah, corona and influenza, totally different. Possibly driven by some of the same factors. Possibly not driven by any of the same factors. We just don't understand. And this is a new virus, and I think it's good to assume assume the worst. Assume that the virus is going to spread farther and faster than it can, because then you will get even people who are reluctant to take precautions to take the right precautions, and then it won't spread. Yeah, uh, um, and I really don't want this virus to spread anymore. I would really like to be rid of it. People keep finding reasons to do things that they want to do that are not things that'll keep the coronavirus down. And so here we go. Yeah. So it keeps going. Anyway, that's enough of that. I hope that answered your question, Fiona. Thanks very much. This has been Ask Dr. Ben.